Well, friends, welcome to today's session. And today we will be discussing a new tool which we have created by modifying certain prompts within uh, ChatGPT and applying some artificial intelligence within it. Uh, I hope you are all familiar with the artificial intelligence in the current scenario. You can write in the chat box. Now, this is a tool which looks into the error analysis or any problems which we can see in our day-to-day work. So, let's see, we take a hypothetical situation in which we get some kind of a root cause analysis is not it is a tool which is being used all over industry and uh, in medical sciences also the hospital administrators and community medicine specialists, they all apply. Let's take a hypothetical situation that there is a stillbirth following reduced fetal movements, and we want to investigate this using the root cause analysis technique. In root cause analysis, I'll be elaborating just now. There will be uh, no blame, but working on the system. Can you see the screen? So if you see the root cause analysis of an event, stillbirth following reduced fetal movements. So event title, a hypothetical names, a pregnant woman presented with concerns of reduced fetal movements. The clinician response was delayed and fetal monitoring and escalation were either incomplete. This is so the data to be collected is EMR, triage notes, telephone logs, guidelines, staff interviews, rostering, the 5 whys: lack of standardized triage, contributing factors, human factors, inadequate staff training, environmental staffing shortage, communication, reassurance given over phone without in-person assessment system, corrective actions to be taken, implement the national guidelines, and weekly review of all RFM calls. Lessons learned are the 5 whys analysis. Why did the stillbirth occur? Fetal distress was not recognized or acted upon. Why was fetal distress not identified? Delay in person evaluation after the RFM report. Why was the evaluation delayed? Because phone advice was to monitor at home and understaffed tried delayed CTG. Why was the phone advice inappropriate and staff unavailable? Because no standardized protocol for RFM triage. Staffing gaps are unaddressed. Why wasn't a protocol? We continuously place the the whys, and there is a lack of risk-based trial training and resource planning. Would anybody like to give me a hypothetical uh, error in the from the ward or teaching? Any hypothetical?
Blood transfusion reaction.
Okay. Blood transfusion.
Dr. Sanjay,
Yes.
you sent us the link. I explored the app. The thing is that you need to put the real situation there.
Yes.
Maybe the whole case record of the patient. Then only
Actually,
it,
all that is that is because most of the prompts, they have been placed in the background. I'll just show you. That is why this tool has been created, and it will be ideal if the whole case record is presented. But for demonstration purposes, I am just showing you this. I mean, in a real case scenario, we can have the whole case record. I mean, in the background, what appears, we are just writing one line, but in the background we have placed prompts which start searching for this into the database. This is the beauty of artificial intelligence. Ideally, if maximum data is provided, that will be great. I'll be
So if we have a whole case record file
yes.
and we upload that file and then see how
Then it will give even more focused responses. I mean, what you are saying is absolutely correct, and you will not be. I mean, because many these hallucinations are there, but gradually the incidence of these hallucinations is decreasing. But still, this is a tool which was there even before artificial intelligence came. The root
Sir,
cause analysis is a tool which is already there. I attended a workshop on root cause analysis 10 years ago in Maulana Azad Medical College by their medical education unit.
it's a standard,
And artificial intelligence is something
whatever.
new.
Yeah.
So what I have
Whatever.
done, we have compiled the RCA tools into artificial intelligence. Just one, we will discuss we will answer your question after the PowerPoint. Let me present.
sir, I have a just small submission. Can I submit, sir, with your permission?
Yes, yes,
Sir, like I can see in the browser you have written root cause analysis GPT. Is there a special kind of a GPT for root cause analysis? If so, can you please share the link, sir, in the group, sir?
okay, just a moment. Yes, that I can do.
Dr. Sanjay, can I just say something? For
Yes,
quality improvement, these are all standard ways of, doing the root cause analysis.
yes,
So unless it is doing for that, but we are all using these methods for QI. All our
yes,
QI projects, we do it like this only.
yes,
So in fact, when you called in today morning, I was into one of those meetings itself. So
yes.
these are just the standard things.
These
So
are standard things.
yeah,
There's nothing new in this.
no, unless, but it becomes very easy because I have
Yes,
been, yeah, I've right now I'm doing some audit of perinatal deaths
yes,
through UNICEF. So I'll try using this. I'll just, try, but I'll have to, I think I'll have to make a PDF of the files. I already made the tool and we have filled the tool. We have gone to different facilities and we have
yes,
tried to fill that. But there's a lot of missing data as is usual because
yes,
we filled it from the record files. But
yes.
to utilize this, what I found that if it can be, I can just upload that file and make a PDF of that whole tool for that particular patient, and then I will see how it works.
Yes, you can do that, and then it will be even more focused to your case. You understand?
So, for example, there's an IUD, and unless I put in the CTG, unless I add the CTG and the timing of the CTG,
Yes,
what
all that you will have to add. All that you will have to add. But this will give you a template.
Okay.
I mean, I am creating such lectures for all specialties, from anatomy to surgery. So this was today was more focused session for the obs and gynae, but we are doing this for all specialties, including supposing you have given a OSCE test and the students are not performing well. So you can correct it and without blaming anyone, just do the corrective action.
Yes, of course, the culture of name, blame, shame should not be there.
Yes. So, and for this, the tool is root cause analysis. So, if we have to explain to a very young child of 10 years what is root cause analysis, supposing you have a toy car that keeps on breaking, and the RCA helps us to why it is breaking. So, why did the wheel of the car fall off? Because the screw was loose. Why was the screw loose? Because it wasn't tightened properly. Why wasn't it tightened? Because the instructions were unclear. And fixing the real reason, that is the unclear instructions in this case, we can stop the toy from breaking again. So this is in a nutshell what is root cause analysis. So why is it important in medicine? It prevents medical errors, and in the case of obs and gynae, even small errors can have very serious consequences for mothers and small babies. And the aim for this is to identify potential errors even before they happen. And by systematically analyzing adverse events, hospitals can implement changes that make the maternal gynecological care safer for everyone, and it saves lives in the long run. So one of the key points in this root cause analysis is the 5 whys process. So the 5 whys is a simple but powerful question technique. I mean, basically you ask for first the basic why, then a deeper why, and a deeper why, and again a deeper why once again. So this can help us understand anything like maternal hemorrhage, birth injuries, surgical complications, or a student's class not coming to the OPD, or low attendance, or low performance of a particular class. Anything we can apply. So, firstly, we should clear the problem statement. The first step is to, for example, the patient received a wrong medication during cesarean section. Then we have to be very specific. Include details when, where, and how the event occurs. And avoid any way, this is where you said that we have to give the actual data. Yes, if you give the details, then it will even give better response. And focus on facts. Use objective information from medical records, witness accounts, any other relevant documentation. A well-defined problem statement is the foundation of successful root cause analysis. It ensures that time is aligned on when they are investigating. So the first why did the patient get wrong medication? And in this case, this is a very simple, because the nurse administered medicine from the wrong patient chart. So this is a very superficial why. The first why begins, it moves us beyond the immediate event and to the first layer of causation, that is wrong chart used. And when facilitating this step with your team, encourage open and honest discussion without blame and judgment. The goal is understanding and not punishment. The second why. Why did the nurse use the wrong chart? That is because the charts were not labeled properly. Notice how we begin to uncover. We start uncovering the process very slowly, and we come up with the deeper cause. Then second why were the charts not labeled properly? Because there is no standard labeling procedure for obstetric patients. Now we are uncovering the potential policy and procedural gaps. We move into the even deeper, that we need a standard labeling procedure. And this reveals what can be done at the administrative level or systemic level. Fourth why is why there is no standard labeling procedure. Because hospital lacks a clear policy on chart management for obstetric patients. And we are now identifying gaps at the hospital policy level that contribute to the risk of medication errors in the obstetric and gynecological department. And this helps us move into deeper at the policy level of procedures which help the safety along multiple departments. The next why is why does the hospital lack clear policy? That is the final why, because no one was assigned the responsibility to create standardized chart management policies for maternal care units. And now we have identified a root gap, the gap in the responsibility assignment in creating and maintaining critical policies that affect patient safety in obstetric care. This root care exists in the organizational level and requires a systemic solution rather than addressing just the medication error. So this way we involve the whole system from a very simple error, and this way we can prevent this error from occurring again. So the 5 whys summary: identify the root cause, that is no assigned responsibility for creating chart, implement solution, assign a dedicated team to develop and enforce standardized chart labeling, and measure the results for 6 months. And this way we can continuously make changes within the policy of administrating a ward or a hospital. So there is something known as a fishbone diagram. Now, fishbone diagram, this was a simple technique which was created in Japan to solve these issues. And the same thing which was there, in fishbone, there is a staffing factors, the method, the clinical protocols, work outflows, documentation procedures, measurement, vital sign monitoring, lab results, the machine, the material, the supplies, all these are there in the fishbone. And they, on a single page, they figure out what went wrong. It is a continuous tool for presenting in front of us the fishbone diagram. And how do you create it? Define the problem, write the problems at the head, and draw the main categories, create the main bones, people, equipment, processes, supplies, standards, and brainstorm the causes. add smaller bones this way, and drill down further, use the why questions to make even smaller bones. So this way the fishbone, it appears. The people, processes, staff fatigue, training gaps, inconsistent medication, equipment and materials, similar packaging of oxytocin and other drugs, medication storage issues, confusing drug labels, lack of error tracking system, unclear dosing protocols, poor lighting in medication rooms, and distractions during preparations. So, and this, when we create a fishbone diagram, it is important to invite multidisciplinary team, the obstetricians, the nurses, the pharmacists, the administrators, and use a large whiteboard or digital platform for visibility. And you can also use sticky notes for team members and allow everyone to contribute without judgment. And similar ideas, you bring them together, and thus by voting together, you identify the most likely causes and support with available data when possible. Circle the high impact items for further investigation and develop targeted actions for top causes. Create testing criteria to validate the root causes. And the benefits, I mean, these are used, fishbone diagrams, they are used all over the world. In wherever there is a lot of people, that they are used in factories, they are used in various government departments, and so similarly they are also being used in healthcare. But earlier they were being used by only people who are trained in hospital administration, but now they can be used by anybody with the help of certain this artificial intelligence technique. So the fishbone diagram, it visualizes complex problems, creates clear visual representation, encourages collaboration, and brings together diverse perspectives from obstetricians, midwives, nurses, and identifies multiple root causes and supports quality improvements. So this is how a fishbone diagram can be used. So I'll just show you. An image takes a very long time in the but this is how it can be generated with this tool. Manpower, methods, patient factors. I had created for uterine rupture, the environment, unclear escalation process, communication. So all the points are there. And you can use a fishbone diagram for analyzing any problem. Now, one variation of the fishbone diagram is the fault tree analysis. Now, this is again, this has been used in the aircraft industry and nuclear industry, but now it is being made available to healthcare industry also. And this is adapted for healthcare to analyze complex adverse events, and it just like a fishbone diagram. It creates a top event, that is the problem, and branches they move along the, so this is the faulty tree in a maternity ward. So maternal hemorrhage during delivery, unexpected NICU admissions, surgical complications during hysterectomy, the medical errors in labor and delivery, and also we create we can create various points, and how you create a top event and clearly articulate the adverse event being analyzed, and then you identify the immediate causes. For example, neonatal injury during vacuum assisted delivery, and then we determine the direct factors that could lead to top event and improper technique and equipment failure. Break down causes, analyze each immediate cause to identify sub-causes and contributing factors. Apply logic gates, use whatever possibilities to show relationships, and then verify and refine. So this is how a faulty tree analysis can be done. Top event, major causes, and sub causes, and thus we create a faulty tree examination. So this also helps in creating the logical relationships, safety prioritization, and also we can quantify, but it is something similar. For all practical purposes, the the root cause analysis is good enough. So the limitations of the fault tree analysis, they could be the complexity could be a problem, and it becomes very complex for all obstetrics scenarios. It could be time consuming. The expertise requirements are also quite a lot, and you need some basics of the technology. The human factors, it may oversimplify the complex human interactions, and the cultural and organizational factors, they can be troublesome. They could be different in different institutions, and the communication issues are sometimes not picked up, and thus the implementation challenges are also there, because the resource intensive or busy clinical departments may require external support. And in the end, there is a A3 problem solving technique. This has also been placed in this GPT, and this is to have the entire report on a single page, single A3 report, and which can be placed somewhere where everyone can see, and everyone can take action according to that single report. The A3 reports help teams tackle persistent issues like C-section report rates, postpartum complications, or delays in emergency response. So how do you create an A3 problem solving report? The background, explain why this problem matters to maternal and women's healthcare. The current condition, for example, describe what is happening using the data which is available. For example, 12% PPH rate versus 5% benchmark. The goal, defined by when you should reach the benchmark, 6 months, 1 year. do the root cause analysis, apply 5 whys, Fishbone or FTA, countermeasures, specific solutions to address the root causes, implementation, and the follow-up. Then in a medical setting, the problems and analysis and high rate of falls in postpartum units, root causes identified. They could be inadequate staff training, poor lighting in bathrooms, lack of call button accessibility, and countermeasures could be implementation in the staff education programs, installed improvement in lighting and in all bathrooms, redesign call buttons, and there could be a change in a defined period. So the A3 problem solving techniques, because it is on a single page, there is clear communication, there is a team ownership, it's an integrated approach, and there is a method by which there is continuous improvement. And at the end, we have to integrate all the methods, the 5 whys, the Fishbone, the faulty tree analysis, and A3. And the 5 whys are used to dig the specific causes and go deeper and deeper. The A3 technique documents the entire problem solving and makes it available to all of the stakeholders. The fishbone technique applies to organize and visualize multiple potential causes across different categories, and the faulty tree analysis helps to analyze the logical relationships amongst different causes, and all these tools, when combined, they help in achieving the maternal and gynecological care. So, for an effective root cause analysis, there should be a team composition, the frontline staff who witness the event, involve the obstetricians, midwives, nurses, specialists, fresh eyes like a social worker who was not involved in the event, and also consider the patient herself and the family. And you also set clear timelines, use structured template to guide analysis, and designate a trained facilitator. The cultural considerations could be, we have to avoid blaming anyone and create a psychological safety for an honest discussion, and also acknowledge the emotional impact on the staff and celebrate improvements as a result of root cause analysis findings, and ultimately follow through clear ownership for action items, establish the metrics for to measure improvement, and schedule regular follow-up reviews. So these are two case studies. A tertiary hospital care's obstetrics department identified frequent medication errors and delivery within 8 errors per 100 days. And we do the RCA process, and ultimately the key findings: standardized labeling and implemented for high-risk medications, target staff, double check protocol, and electronic medication verification system is implemented. Outcomes: medication errors reduced by 40% within 6 months. So similarly, there is another preventing surgical site infections. Problem identification: a woman's hospital noted concerning 12% surgical site infections. All the RCA tools are applied, the root causes are identified, and there is inconsistent adherence to pre-operative skin preparation protocols, suboptimal timing of prophylactic antibiotics, and ultimately there are results. Now, there are some challenges to RCA implementation because our system is not generally ready, but the change management process has to be applied. This has to be done consistently over the years. There has to be resistance to change. There will be resistance. The lack of multidisciplinary involvement, time constraints are there, fear of liability, insufficient follow-up, and incomplete data collection is quite often there. And to overcome these, we have to secure visible support and provide training on RCA methods, develop the RCA champions within each clinical area, and create a curriculum for residents on safety culture and root cause analysis. There should be clear communication at all levels, structured tools, and there should be continuous learning. The future trends, the digital health has to be there, and there has to be real-time analytics and enhanced simulation and human factors to be involved. So with this, we end the session. Root cause analysis is not about assigning blame. It is about creating systems that make it easier to provide exceptional care to every woman and baby in your practice. So we will go back to the tools once again. So would anybody like to give me some problem, or we can show you in an OSCE examination at the end of labor room posting. The interns failed in a test. Most of the interns failed in a test. So let's see. This is providing the templates which you have to fill up. If you give greater detail, it will provide greater details. So, intern OSCE failure, post labor room posting, insert date, names of the doctors, clinical instructor, problems. The majority of interns failed post OSCE examination. The result triggered concern from faculty, students, and academic leaders. The data collected is the OSCE blueprint station design, internal logbook, skill sheets, teaching schedule versus OSCE content mapping, faculty and intern feedback. Now, the root cause analysis, misalignment between OSCE content and clinical teaching exposure, lack of formative assessment and feedback during posting, contributing factors, human limited faculty to intern supervision, no structured skill log review, environment overburdened labor room, limiting hands-on training, method OSCE station design not piloted or these could all be the contributing factors. Then there are correcting factors, align the teaching objectives with OSCE blueprint, and the 5 whys. Why did the interns fail? They were unprepared for assessed clinical scenarios. Why were they unprepared? They had insufficient hands-on exposure on skill practice. Why didn't they get adequate exposure? No structured skills tracking. Why wasn't there structured oversight? Faculty were overburdened, system lacked teaching accountability. Why is there no teaching accountability or resource planning? The curriculum lacks integration of competency-based logs and teaching audits. And if you ask it, it will create the fishbone diagram also. I'm not creating it because it takes almost 4-5 minutes to create a fishbone diagram. It requires a lot of internet support. And we can also create a PowerPoint, a PDF reports. All these are built in within this tool. Now, would anybody like to give me one problem scenario?
Sir, can I give one problem scenario, sir?
Yes, most welcome.
Sir, I wanted to attempt the root cause analysis of stockouts of various essential medicines in primary health centers working under the health department of the Union Territory of Chandigarh, sir.
Okay. Can you just speak once again?
Yes, sir. Sir, I wanted to do root cause analysis of stockouts of various essential medicines in the primary health centers of UT of Chandigarh.
Okay.
Sir, should I speak again if the
I think I'll
Sir, I'll seek
RCA of
of stockout of medicine, sir.
stock out of
Essential
medicine.
medicine. Essential medicine.
Okay. Essential
Medicines
medicines
in sir Ayushman Arogya Mandirs.
in Ayushman Arogya
Mandir, sir.
Mandirs in
Operating under the health department of UT of Chandigarh.
operating under the health department of Union Territory of Chandigarh.
Yes, sir.
Okay. Let's see. So the problem description: multiple Ayushman Arogya Mandir in Chandigarh experience stock out of free essential medicines, especially antihypertensive, antibiotics, diabetes drugs, resulting in patients paying out of pocket or foregoing treatment. This is a hypothetical. I mean, ideally we should provide the details, but here this is a hypothetical problem description. And the time period in the first quarter, in the fourth quarter, January to March 2025 and May 25. So, and data collected, I mean, the state essential drug list, procurement records, stock registered, central supply, distribution schedules, staff interviews, patient feedback, SOPs on drug forecasting, and root causes identified, ineffective demand forecasting and supply planning across UT level supply chain, inadequate last mile logistics and buffer stock policies of Ayushman Arogya Mandirs, contributing factors, the people is limited staff in pharmacies and logistics, frequent duty cancellations, understaffing, and this has also provided the references if you want to know from which references it has taken. The methods, lack of standardized reorder levels, machines, delayed or infrequent deliveries, insufficient transport coordinations, materials, central procurement delays, environment, rapid scale up of Ayushman Mandirs, stretching existing supply infrastructure, no real-time stock dashboards or audit loop, medicines available from hypertension or for hypertension and diabetes, and then the corrective actions and the monitoring and evaluation plan, daily monitoring, monthly audit, feedback loop, lessons learned, and then comes the 5 why analysis. Why did the stock out occur? Medicine not available. Why were they not available? Because central supply did not dispatch. Why was supply not aligned to usage? No robust forecasting or buffer stocks. Why was forecasting system weak? Demand data not captured in centralized IT dashboards, staff overwhelmed. Why was the system overwhelmed? Because the Ayushman Arogya Mandir scale up outpaced capacity building in procurement, logistics, and staffing. So, this provides you a rough idea of what could be the possible RCA parameters.
Yes, sir. Actually, sir, that's very well done, sir.
Yes. I mean, I am trying this for almost 15 days now and I'm practicing with this and correcting the background prompts. Almost a lot of effort has gone into it, but
Yes, sir. Wonderful, sir.
yes. And this
Sir,
tool can be used in all the medical colleges and all the health hospitals all over India.
Sir, this RCA GPT which you have shared in the group, we can also use it, sir?
Yes, anytime. But rather you should do a trial just now if you are on laptop.
Sir, I'm not on laptop, sir. But
Okay.
sir, but because I'm part of the group, so I'll mail that GPT link to my email, sir, and then launch from there, sir.
No issues. Most welcome.
Sir, I had a question. I mean, how much time it took, sir, to prepare the GPT and this RCA specific GPT, and what all resources went into it, sir?
Firstly, I had to buy a paid
Subscription.
paid subscription of GPT, and along with that, I had to, because I am these days doing a 6 months long artificial intelligence course, and from an engineering university, and there they taught us different kinds of prompt engineering.
Okay, sir.
And by combining multiple prompts, and there are different kinds of prompts, there are markdown prompts, there are system prompts. So you have to first create the adequate prompt, and then you have to test it and then change the prompt repeatedly. Once after this large language model is trained, then you can share it, but it will keep on improving over a period of time.
Okay, sir.
I mean, the prompts, they are there in the background, but if there are some things which need to be added, we will keep on adding.
Okay, sir.
So anybody else wants to ask any question?
I think, Dr. Bedi, it's a very good tool, but I'll first try to test it as I
Yes,
do,
please, I'll be very grateful.
and then I'll get back to you.
Yes, because we are constantly in MEUINDIA, we are trying to constantly move into those areas where no one has gone before. So this is another area where, but I know it. This can bring quite a lot of change in the system. I mean, without reducing anyone's efficiency or no blame culture. If we just work on the, I mean, I knew about root cause analysis since many years, since I attended a workshop in Delhi, in Maulana Azad Medical College, but I could never apply it. Until this tool becomes known to everybody, people will not take it seriously. And with this tool, it is possible to any person can start. You don't need a hospital administration degree to do it. You just need to know the details of the problem. This is basically a tool for error analysis and rectify all errors. Medical errors is a very important issue in most of the hospitals and medical colleges. And if we can have a RCA technique, it can reduce the errors. So,
Sir,
yes.
sir, I have messaged you on your DM'd you on your personal number. I'm just confirming whether that is the tool that you had previously shared in the group.
I'll share it once again.
Can you confirm it so that I can start working on it also?
Okay, just a moment.
So, Dr. Sanjay, can I just leave? I have some.
Yes, Dr.
And thank you
Tamkeen,
so
thank
much.
you for coming.
Thank you.
Yes, this is the tool.
Yeah,
I
I'll
mean,
get
I'm very grateful, Tamkeen. I mean, I knew that I need some supporters in the beginning.
No, we have been using the root cause analysis, for all people who are into quality improvement, they are using it. But
Yes.
as I think, this makes our job very easy because it is, if we just upload the data and we just stick.
Yes.
So it becomes so easy for us. Okay, I'll
Yes.
use that and then let you know. Okay, thank you so much.
Okay, I'll be very grateful, waiting for your feedback.
Yeah, I'll do that. Okay, bye.
Bye. Dr. Vaishali, would you like to say something? Okay, with this we end today's session. It's exactly 1 hour. And thank you for your time.
Thank you, sir. Thank you very much, sir.
Thank you. Yes, it is the same one which you have shared with me.
Right, sir. Thank you, sir.